We really always look at the triple win. So we believe that anything that we recommend to our clients and our inspired hygiene clients, it must satisfy a win for the patients, providers, and the practice. And sometimes it takes some thought and real intentional um, planning to really make that happen. And sometimes it's super easy, right? So, what we've seen with patients in this assisted hygiene model is there's just more time for that high touch care, which includes things like airway screening, blood pressure screening, all of those things that the hygienist wants to do, but so often runs out of time. And a lot of times, what we find hygienists do, and I know I've done this in the past, was we're like, okay, if I have time, I'll do it at the end. And then typically scaling fills the time, talking fills the time, something else fills the time. And there are truly, this is not an exaggeration, life-saving screenings that hygienists perform, and some of those dental assistants can perform as well. So that's a huge win for patients. Also, adding additional services that are beneficial for them. And then there's appointment availability, right? It's frustrating. I talk to my friends all the time. They're like, I have the worst time getting into my dentist. For providers, I think, again, it's that time management and having that support so that they know if someone is seated in the other operatory, they are being fully taken care of. So the hygienist, think about all those times that you're with your patient, but there's a patient in the reception area that's waiting, and that's super stressful. I used to have nightmares about that. I'm not joking. I would have nightmares that they were stacked like out the office waiting for me, and I was moving in slow motion. So, that can go away because you have that partner. It gives everybody diversity of services, and you just have that really great team energy. And for the practice, obviously, it can create increased profitability. There's often improved technology usage. Think about the digital scanners that you have in your practice that you really would love to get into hygiene. And also think about that restorative co-diagnosis piece. So when doctor walks in, everything is just arranged and it doesn't feel rushed to anybody, and they can really have pre-presented any restorative needs that they see are pretty obvious. So lots of benefits there.